Does lifting your arm cause pain or discomfort? You might be dealing with a condition called supraspinatus tendinitis. In this video, we'll go over diagnosis, management, how it happens, and how you can get better. Keep watching to find out. The supraspinatus is one of your 4 rotator cuff muscles responsible for moving and stabilizing your shoulder joint. Now, the supraspinatus specifically is responsible for shoulder abduction, which is raising the arm next to you. Tendinitis is a condition that is inflammatory in nature. The word tendonitis refers to tendon being the anatomical structure that's being affected, and itis referring to inflammation that is occurring. Now, more research has recently been pointing that you can have pain or discomfort even in the absence of inflammatory chemicals. In this case, we call it tendinosis or tendinopathy, but really all these conditions fall on a spectrum of tendon disorders or pathologies. The good news is whether it is a tendinitis, a tendinosis, a tendinopathy, you're going to be managing this condition relatively the same way. And that's because we're going to be taking advantage of a musculoskeletal principle called Wolff's Law. Wolff's Law basically says that a connective tissue, like your tendon, your ligament, or your bone, will respond to mechanical loading and stress by growing stronger in the direction of the load. In this case, we're going to be using shoulder abduction exercises to stress progressively in an appropriate manner so that it could grow nice and strong. Some common causes of supraspinatus tendinitis is repetitive overuse or repetitive stress. And this usually happens in occupations that really require a lot of shoulder movement. We're talking about professional athletes dealing with it, and overhead movements needed in sports like volleyball or tennis. We're talking about electricians that have to reach overhead, mechanics. But really, this condition could affect anyone so long as there is repetitive stress going through this tendon. When you do have issues with your supraspinatus tendon, you can have pain while raising your arm, trying to lift an object overhead, trying to reach back when you're trying to use your arm to reach for the back seat in your car. And you can even experience some weakness depending on the severity of the tendinopathy. Now, usually to get diagnosed with this condition, you would want to consult your healthcare team, predominantly your sports physiotherapist or chiropractor. Your medical doctor may order ultrasound images or MRI to diagnose you with a supraspinatus tendinitis, but really it can be diagnosed without using these diagnostic images. And I'll be showing you some of the tests that we do in the clinic to identify whether or not you have a supraspinatus tendinitis. The first test that we typically do is called the full can test, and this test really challenges your supraspinatus tendon and its ability to handle load or forces going down upon it. Typically, when you have a supraspinatus tendinitis or a tendinopathy in general, a movement involving abduction will be painful. So in the full can test, your hand will be in a palm forwards position where your thumb is pointing towards the ceiling, and your arm is going to be next to you at about 30 degrees in the horizontal plane, which means that my arm is actually 30 degrees forwards. It's not just right next to me when I'm doing this test. This is what we call the scapular plane, but you don't need to know about that too much. From here, what will typically happen is that your therapist will put pressure on your arm, and then you'll be asked to resist this force. So they'll be putting down pressure, trying to lower your arm. You're going to resist it with equal amount of force so that you're not really overpowering them. And a positive test is both weakness and or pain experienced in the shoulder joint. The second test that we typically do is similar in nature, but it's called the empty can test. And it's called an empty can test because it's as if you're holding a can and you're trying to empty it out. So your hand is actually going to be rotated in this downward position and in that same scapular plane where our arm is in front of us, about 30 degrees. In this test, your therapist will then put pressure downwards on your arm. And again, if this triggers the pain, that's another test that can verify whether or not you're dealing with supraspinatus tendinopathy. Now, the problem with just relying on these 2 tests is that they won't tell you if there's any other type of rotator cuff involvement or if there's some sort of internal impingement mechanisms happening that's causing you to feel pain in the shoulder. So it's really important that even though you know that these 2 tests are positive, you still want your other rotator cuff muscles ruled out. You still want your other shoulder diagnoses ruled out. So it's really important that you consult your physiotherapist or chiropractor to know which condition you actually have. All right, now let's talk about what you actually can do to start your recovery process. Now, before we get into that, please understand that a tendon recovers relatively slowly compared to bone injuries, compared to muscular injuries. You can be expecting it to take anywhere between 3 to 6 months of recovery. And that's with you being fairly consistent with your exercises. And of course, this depends on the severity of your condition. That being said, you should notice week-to-week progress and week-to-week gains. And as such, you will be challenging your supraspinatus a little differently week to week as well. Although you want to be consistent with the overall theme of challenging this muscle and shoulder abduction, you may need to change the intensity of the exercise, the volume of exercise you're doing, so that's how often you're doing it in terms of reps and sets. Or you may need to upgrade your movements to become slightly more dynamic and challenging down the line. Now today, we're going to be going over a few exercises that you could do at the start of your program, a few that you could do in the middle of your program, and a few that you could do towards the end of your program. The first exercise that we'll actually be doing is called an isometric exercise. And the reason why we're doing an isometric exercise is because no movement is occurring. And the reason why we want to do that is because this type of exercise is actually the least inflammatory that you can do for a very acute shoulder. Again, supraspinatus tendinitis being an inflammatory condition, we want to still make sure that we're not re-triggering any pain or flaring anything up. So we're going to start nice and simple with an isometric exercise. Now for this exercise, all you really need is a wall to kind of block your movement. This exercise can also be done in your doorway, which actually might be a little bit easier as a setup, depending on how much space you have in your house. For this exercise, you're going to stand next to the wall and abduct your arm with your elbow bent at 90 degrees so your forearm goes and meets the wall with full contact. From here, you're going to push your arm into that wall and you're going to hold a 30-second contraction of you pushing into that wall, and you're going to push as hard as you can without it hurting. Now, it's really important that while you're doing this exercise, you're only really abducting your arm to an angle where it hurts at a 2 or a 10 pain intensity or less. And it's not that you should be chasing the pain. I actually prefer that you do this exercise completely pain-free, but with the tendonitis, sometimes a little bit of pain is going to be expected and a little bit of pain may need to be pushed through. At this point, at 2 out of 10 intensity of pain, I really call this more of a discomfort than a pain. So you might feel like things aren't really comfortable or things don't really feel normal when you're pushing through. That's okay to push through. But if it actively actually hurts, it causes you to wince or really doesn't really feel good, then find an angle that's a little bit more shallow so that it stresses your supraspinatus a little bit less. Alternatively, if you have pretty good range of motion, but it's more of a strength production related pain, then just scale back how much force you're putting into that wall until it becomes, again, 2 out of 10 pain or less. You'll be doing about 3 sets of this exercise every day, and that's so we can start stimulating some recovery in that tendon via Wolff's Law. We need to do that long time under tension to get reformation of your tendon. While you're doing this 30-second hold, you're really going to be pushing at about 6 out of 10 strength. If you're finding that the 6 out of 10 is a little bit too much pain to push through, it's okay to scale back how hard you're pushing and instead just increase how long you're holding it for. Likewise, if it's really more of a duration-based pain where activating the muscle for a long time causes increased pain, then make it a little bit shorter and you can actually increase the intensity instead, or you could just keep shaving back. So a lot of this is very flexible depending on your pain experience. So keep in mind that you want to be challenging the tendon. You don't want to be running away from pain necessarily, but you would want to be pushing through discomfort. Most of the time for my own patients, I get my patients to do this for 1 or 2 weeks against the wall, and they're doing this every single day. While you're doing this exercise, you should notice that day to day or week by week, you'll be able to do a greater or a deeper range of motion where you can raise the arm a little bit higher and you'll be doing it from that position. So really every time you're doing it, please check how high you can go and challenge it from that position. Now moving into weeks 3 and on, we're going to be doing more of a dynamic exercise, and we're going to be progressing this depending on how well you can tolerate the weight at different angles. So the first version that we'll be doing is a lean away or a hanging lateral raise. And the reason why we're doing this version is because it actually recruits more of your deltoid and upper trapezius to support your shoulder and a little bit less of your supraspinatus. The reason why we're doing that is because we kind of want to spare the supraspinatus from working too hard, as right now it just might be a little bit sensitive to all the pressure that you're trying to put through it. Usually for this exercise, I get my patients lifting at a 6 to 8 out of 10 intensity, doing about 3 sets, 10 to 12 repetitions. And because you're doing this at a higher intensity, you're only really doing this exercise 2 to 3 times per week. If you find that your range of motion for the hanging lateral raise is now full and pain-free, you can now progress to the standing lateral raise version. So in this position, due to the gravity lines or the way that gravity is being applied to the force of your dumbbell or weight, it'll challenge your supraspinatus a little bit more compared to trapezius and your lateral deltoids. In terms of how many reps and sets and frequency, it's going to be the same as the hanging lateral raise. We're just changing the position. We're opening up that range of motion now. So again, about 3 sets, 10 to 12 reps at an RPE of 6 to 8 out of 10. As you're progressing along during this period, you will then evolve the exercise to the lean and lateral raise. And the reason why we're doing this is because it puts the supraspinatus in a slightly more stressed position, which will stress that tendon a little bit more. Usually I would get people starting off at about a 45-degree angle, leaning into the wall, but you can deepen this as your shoulder gets stronger and stronger, up to 60 degrees. You really want to do this so that you're starting with your hand in the middle of your body, and then you're abducting it just above shoulder height. This position can be a little bit painful when trying it for the first time. If you do find that it is, then you could just wait another week and then push it off until you feel like you're ready for this exercise. For this exercise, it's really important that you're using a really stable surface. If you don't have access to a wall and you're in the gym, you could do it against a squat rack, you could do it against a functional trainer, just something that won't really budge under the weight of your body. As you can see, the line of drive and the angle that gravity applies to your dumbbell is changing compared to the lean away lateral raise. So this will challenge your supraspinatus tendon a little bit more. All right, now we're starting to think about challenging the supraspinatus muscle to stabilize that shoulder joint in a full range of motion. So my favorite exercise to prescribe to patients with the supraspinatus tendinitis and the late stage of their program is called the Lou raise. And for this exercise, you could be doing it with a dumbbell. I know traditionally it was with a weight plate, but you really don't need to use a weight plate, but you're going to use a dumbbell and you're going to raise your arm all the way up overhead next to you. Now, it's really important that while you're doing this exercise, that at about shoulder height, you're making sure to rotate your hands. So initially you're starting with your hands, palms facing inwards, but as you get to 90 degrees, you'll be moving your palm forwards just so that you're not causing any impingement mechanisms to occur in the shoulder. And it's not that like an impingement position is a problem, it's just right now you're already dealing with an issue, and let's just not make things sensitive unnecessarily. Similar to what our strengthening program was in the last phase, we're going to be doing anywhere between 10 to 12 reps, 3 sets, and an RPE of 6 to 8 out of 10. Now, why do I keep bringing up this RPE? Because your shoulder might innately be stronger than the person next to you compared to your brother, your cousin, your sister, your father, your whoever. All these people could be having supraspinatus tendinitis, but your baseline strength is going to be different. So as long as the difficulty of the exercise suits you as a person, that's all that matters. So that might be for you that you're lifting 10 pounds, it might be for your brother 6 pounds, it might be for your cousin 15 pounds. You just focus on how much weight you can lift. And please keep in mind that even though I gave you 3 sets and 10 to 12 reps as a rep range, you do not have to stick to these strictly. This means that if you find that you're really fatigued because you had a night out or you just really didn't get good sleep, then it's okay to do a few reps less or a set or 2 less, because your shoulder, guess what, is going to depend on how fatigued and how healthy you are today. So if you're finding that you're tired, please do not force yourself to hit these numbers, because a lot of these things depend on how you're doing. It's important to think about how your recovery goes, because with the tendonitis, the biggest issue with these types of conditions is that pain tends to flare up not during the movement, but after or the day after. What I usually tell my patients is that during the exercise, please do not go above a 2 out of 10 pain. Secondly, I really do not like if the pain persists for more than 2 hours after you're done your exercise. So a little bit of discomfort, lingering pain for an hour is fine, but if it lasts longer than 2 hours, you just pushed it a little too hard today. Not that it's going to be damaging, but please scale back 10 to 20% the next time you do this exercise. Lastly, if you find that sure after your exercise session it might feel fine, but the next morning after it feels a lot worse, then again, take that as a sign that you pushed it a little bit too hard, and that's okay, but let's scale back so we can be smarter about how if things feel when you're doing your exercises. Now, I always like to say it's highly recommended to consult your physiotherapist or your chiropractor before trying out any new exercises, and that's including the exercises you saw in this video today. If you're in the Greater Toronto area and you're looking to get some help from a physiotherapist or chiropractor, we have 2 clinics, one in North York and one in Markham, that you could come visit. Just visit rehabhero.ca to book an appointment. If you have any questions or concerns about the content of this video, just let me know in the comments below. I'll get back to you as soon as I can. If you're new to my channel, please hit subscribe, hit that like button. I'll see y'all next time. Peace.